very much, ladies and gentlemen. The Ministry of Health brings to the attention of the general public the ongoing strike action undertaken by the Ghana Registered Nurses and Midwives Association, born out of the ongoing discussions on the new conditions of service signed in May 2024 and originally scheduled for implementation in July 2024. Upon assuming office, we have, on behalf of government, engaged several times with the GNRMA to explore the best possible avenue to approve and implement the new conditions of service. While expressing our deep regret over the current impasse leading to the strike and the suffering patients enduring, the ministry states emphatically that government appreciates the invaluable contributions of Ghanaian nurses and midwives to the development of the health sector. Government remains committed to the needed engagement that will lead to the approval and implementation of the new conditions of service for nurses and midwives. Accordingly, government has directed the Minister of Finance and the Fair Wages and Salary Commission to, as a matter of urgency, lead the development of a roadmap to ensure a smooth implementation of the process. We engage the leadership of all Nurses and Midwives Association within the health sector on 30th May 2025 to address their challenges and discuss the subsequent roadmap leading to the implementation of the new conditions of service. Fortunately, the other associations supported my intervention, with the exception of the GRNMA, which declined and proceeded to declare the strike on the 2nd of June 2025, despite the NLC caution. The National Labour Commission on Thursday, 5th June 2025, summoned all stakeholders to an emergency meeting to address the matter. However, the GRNMA failed to attend the meeting. Consequently, the NLC was compelled to take legal steps to declare the strike illegal and called on the GRNMA to immediately call it off in line with law. Yesterday, Monday, 9th June 2025, we invited the Fair Wages and Salary Commission to engage the GRMA, the Minister of Finance, and the Minister of Health to deliberate on roadmap for the successful implementation of the new conditions of service. At the meeting, the Fair Wages and Salary Commission once again, in accordance with law, directed the GRNMA to call off the strike to allow negotiations to continue. Government wishes to stress its readiness to further engage with a view to implementing the conditions of service in a manner that does not dislocate the national budget. We wish to draw attention to the fact that the conditions of service under reference are not captured in the 2025 budget and will completely throw the economy off gear if implemented immediately in the manner it currently exists. We are mindful of the serious economic consequences of unbudgeted expenditure and want to avoid the economic slippages that led to the hardship in the recent past. Government commits to continue to engage with the nurses in order to achieve a mutually acceptable outcome in the interest of the public. While working around the clock to resolve the impasse, the Ministry of Health has taken the following steps to mitigate the suffering of Ghanaian patients unduly affected by the strike. The Ministry will, in the next few minutes, publish a comprehensive list of facilities to complement facilities where nursing services are lacking and where patients can seek health care. Given the urgency of the situation and suffering of the patients, government appeals to public-spirited retired nurses and midwives to volunteer their services for a brief period pending the resolution of the impasse. We further express our deep appreciation to practicing nurses who have opted to remain at post to help suffering patients and urge others to show similar fellow feeling and assist our ailing compatriots even as efforts are made to address their concerns. In conclusion, government reiterates its commitment to dialogue with the GRMA with a view to resolving this impasse for full nursing services to be restored. Thank you for the opportunity.
Good morning. We've all heard the Minister for Health, and from the Ministry of Finance, we want to show our commitment to help in resolving this important issue, because our nurses are very, very critical to healthcare delivery, and we appreciate what they do. But the reality is that we have over 120,000 nurses, and the implementation of the current condition of service that they are demanding will have serious consequences for the budget. In fact, if we fully implement it, we are going to add in excess of 2 billion cedis to the compensation budget. We have all committed that in our resolve to reset the economy of this country, we must maintain a 1.5% primary balance surplus every year in order to bring our debt levels to sustainable levels. And so it is important for us to manage expenditure. And so we want to appeal to our revered nurses that we are willing to negotiate, to sit with them and the Ministry of Health to agree on a roadmap that will help us incorporate what can be accommodated in the budget for next year. And we believe that they have all seen the hard work we are all doing to manage the economy better. We want to appeal to them that they should let us sit down and discuss what can be accommodated so that we can all have a win-win situation for all of us. Thank you. Thank you. I don't want to describe any act as an ambush or any deliberate attempt at government or whatever. I think that our nurses are pushing for what they want. It is for us as government to also look at what can be accommodated within the budget. And you will all appreciate the fact that it's a new government that took over, and we have been confronted with many, many, many things. We have to balance everything and ensure that the economy is not thrown out of gear. We have a lot of debt that we need to, we have been confronted with. And so in as much as I appreciate what our nurses do and what they are demanding, we also want them to have faith in the current administration that we mean well, and we are committed to ensure that we have a fair wage for what they do for all of us. And so let us not describe their action in any way that will mar our attempt to resolve this issue. Thank you.
Yeah, thank you very much. And as a mother ministry, we want to still appeal to our brothers and sisters who are nurses to come around the table so that we have lasting solution to this matter. And I can assure them that as a ministry, as their mother ministry, we are the best people to pursue their interest, and we are committed in doing so. Thank you.